Hi, I'm going to show you a very simplified scheme of how to discover a drug. So obviously things are a little bit more complicated than I'm about to describe, but here are the main steps anyway, and they're pretty much what most drug discovery companies follow. So let's imagine you start off with a condition. For example, it can be high blood pressure. To treat the condition, you need to find out what's wrong. So clearly in high blood pressure we've got a negative feedback loop where for some reason it's not feeding back properly. So the first thing you need to do is to find a drug target. That is something in this feedback loop where you can restore what's missing or get rid of what there's too much of. So typically a target might be a protein or a receptor, which is a kind of protein, or it could be absolutely anything in the cycle that controls the situation which has gone wrong in the condition. The next thing you need to do is, once you've found a target, is to find a lead. And a lead is a molecule which to some extent fixes the condition. Doesn't need to do it very well, but it's a start. Right? So you've got some sort of chemical which to some extent fixes the condition. And to do that, you need to do a screen. That is a way of trying thousands, if not millions, of compounds until you finally find one which actually does something. So you screen to find an initial lead. Then what you do is you do your drug development. That's a V, by the way, in which case you take your lead and you make lots of changes to find lots of thousands and thousands or millions of other compounds that look a little bit like the lead but are different, until you find one that really rescues the condition. So each of these points I cover in other videos in which I show you how to choose a target, how to screen for a lead, and how to screen for the better drugs based on the lead.